What's the best medicine to keep in your cupboards, or especially over the holiday season? Just in case, these are important things that I keep in my medicine cabinet, and I thought I'll share it with you. Now, one important thing to remember is if you've got children, it's a good idea to have liquid versions of all the medicine. A couple of things that I always make sure that I cover. One's pain relief. So this is the paracetamol, ibuprofen. You can give them at the same time and you can alternate them as well. Ibuprofen is really good if there's swelling somewhere, so it's not just for the pain. If you wanted to reduce the swelling, make sure that you give it regularly 3 times a day, and after food is much better. Paracetamol, you can give it up to 4 times a day. The other important thing is allergies. So if you've got pets around and sometimes rashes come up on the skin, there is Piriton here, and you can have this up to 3 or 4 times per day. And there are longer acting ones as well, like loratadine, both in liquid and tablet. And loratadine and cetirizine, you can have it once a day, but it will work for the whole 24 hours. Now, the other important thing is indigestion, things that are easy to chew. Mint tea is really good. It does help relieve cramps. And if people don't have an appetite, have diarrhea with you, especially in children. They're really good at regulating themselves, so don't worry if they're off food, but hydration is really important. So the diarrhea and the electrolytes help them keep up with the liquids. There's these dextrose as well. They're a good quick pick me up of energy. And there is Pepto-Bismol as well that helps relieve both bloating and cramps too. The other thing you need to be prepared for is cuts and bumps and bruises. The first thing you need to do is actually wash it clear. There are things like this Dettol, they're quite good, or even tap water. Then make sure you cover it with a cream. So Sudocrem is really good because it has like a antiseptic and a barrier quality to it. Things like Dermaloid or Savlon, they're no-brainer. It's better to have them and cover the bruises with plenty of that. And then plasters, have lots of different ones with you. So waterproof ones, the ones that have got a little bit of a cushion in there. There are big ones as well. And the other important thing is for eye protection. So it gets really tricky when there's a pesky little particle in the eye. So having an eye wash is good. Some eye washes, when you open it, you can still use them for another 3 months, for example. If not, eye drops are a good alternative as well. There are antibiotic ones as well that can clear minor infections, but usually infections are easy to clear up by themselves within 2 to 5 days. I hope this is helpful. If there's any questions you've got, please reach out to us for safe pharmacy-led support and visit our website. There's a lot of good advice there. Thank you.